How do families navigate an IEP for a child with a genetic condition? Imagine trying to find the best way to help your child succeed in school when their health and learning are affected by a genetic condition. It can feel overwhelming, but knowing the steps can make a big difference. An individualized education program, or IEP, is a plan created to support children with special needs. It is a legal document that spells out what services and accommodations a child will receive at school. For families with a child who has a genetic condition, understanding how to navigate this process is key to ensuring their child's needs are met. First, families need to understand that to qualify for an IEP, a child must be enrolled in public school, be between 3 and 21 years old, and have a recognized disability that impacts learning. Many genetic conditions like Down syndrome or Fragile X syndrome fall under categories such as intellectual disability or other health impairment. These categories help determine eligibility. If a child's genetic condition affects their strength, alertness, or health, they might qualify under the category of other health impairment. The next step is requesting an evaluation. Parents or guardians can write a request to the school district asking for a comprehensive assessment of their child's abilities. The school then conducts tests to measure things like vision, hearing, motor skills, social skills, and academic performance. For children with genetic conditions, these assessments should specifically look at how their condition influences learning and development. This could include cognitive testing, language skills, motor coordination, and social behavior evaluations. Sharing detailed information about the child's genetic diagnosis is very helpful. Families should tell the IEP team about how the condition affects their child's learning, behavior, and health. If the child has seen a genetic counselor or medical specialist, sharing their insights can help set realistic goals. School psychologists and teachers often want to understand how symptoms impact areas like reading, writing, or social interactions. This information helps create a plan tailored to the child's specific needs. Within 30 days after the evaluation, the school holds an eligibility meeting. This team includes parents, teachers, and special education staff. They decide if the child qualifies for an IEP based on the assessment results. Sometimes children with genetic conditions may not seem behind in all areas but still need support. Families should explain how their child's condition affects specific skills, even if they seem to be functioning well in some areas. Once eligibility is confirmed, the team works together to develop the IEP. This document lists the child's current skills, goals for the year, and the services or accommodations they need. For children with genetic conditions, goals should be realistic and based on what is typical for their diagnosis. For example, a child with a chromosomal variation might need goals addressing language development, social skills, and academic progress all at once. The IEP should include specific supports like speech therapy, behavioral strategies, or classroom accommodations. Providing information early in the process is very helpful. Sharing genetic and medical details during evaluations and IEP meetings allows the team to understand the child's needs better. If a genetic counselor has provided guidance, sharing that with the school can improve planning. Sometimes, schools may not be familiar with certain genetic conditions, so families can help bridge that gap by providing written summaries or resources from medical professionals. Ongoing communication is important. The IEP is reviewed at least once a year, but if the child's health or abilities change, the plan can be updated sooner. Regular check-ins ensure the supports stay relevant. If new symptoms appear or progress is not as expected, the team can adjust goals or services accordingly. Families should come prepared to meetings with detailed information about their child's diagnosis, medical history, and how it affects learning. Bringing notes from doctors or genetic counselors can help the team understand the child's needs. From early childhood through adolescence, involving the child in IEP meetings when appropriate encourages self-advocacy. If disagreements happen, families have the right to ask for changes or seek additional help from advocates or specialists. Understanding that each child's genetic condition is unique helps families advocate for an IEP that fits their child's specific strengths and challenges. With clear communication, early planning, and ongoing support, families can help their children thrive in school environments that recognize and accommodate their individual needs.